Welcome to the Low Carb Conferences podcast. I'm your host, Dr. Jeff Gerber, and today our special guest is Dr. Andreas Eenfeldt, and he'll be speaking at the conference in February. Team Diet Doctor has participated and sponsored our conference each and every year from the beginning, dating back to 2016. So how's it going today, Andreas?
Thanks, Jeff. I mean, it's great to be here. Thank you for having me. Really enjoyed all the years at your conference. Gotta say, I've met a lot of good people there over the years. So looking forward to 2023 as well.
Yeah, we've enjoyed having you all these years, Andreas, and we go back quite some time. So a little more about Andreas. Andreas is a Swedish medical doctor specialized in family medicine, also an author, speaker, and founder of Diet Doctor Health blog. Working as a family doctor in his earlier years, Andreas discovered nutrition and the benefit of low-carb diets. In 2007, he founded Diet Doctor and eventually quit his day job, seeing patients, so that he could focus on helping a much larger audience online. Diet Doctor has grown substantially over the years and has become the go-to site for nutrition information, both practical and science. I continue to refer patients to Diet Doctor website for the latest and greatest information related to nutrition. So Andreas, if you can provide us with a little more background and tell us about your professional and personal interests.
Yeah, sure. I mean, thank you for the kind introduction. What can I say? I mean, I'm a family doctor, and I've been pretty much obsessed with nutrition and health for 20 years now. Launched a blog 15 years ago, which grew into a company called Diet Doctor. We're now about 50 people. I would say it's the number one site for low carb and keto information. But now we're also evolving, I would say, into more what I think is even more interesting, even though low carb is great in many ways and works and it's been proven. I think there are even more flexible and potentially even more effective approaches when it comes to higher protein diets, higher satiety diets, etc. We may talk more about that, but I mean, that's really my passion, is building tools to make it simple for regular people like you and me and everybody else who's interested to actually implement lifestyle changes in their lives, eat better, improve body composition, improve metabolic health, more strength, more energy, all that good stuff. So so many smart people out here in the world, and I guess I'm just fortunate enough to be able to talk to some of them and take what I think is the sort of the best ideas, and then sort of as an entrepreneur, make them easily available to anybody and build tools around it. So that, I think, is the role of our company, is taking these best ideas from the smartest people in the world and then making it available not just in scientific journals, but in a digestible way for regular people.
Great, Andreas, and I know over the years you're a big thinker. Everything is big with you, and you like to say you shoot for the moon and hit the stars. And all these years, I have remained a doctor in the office seeing patients, and I guess we each have our own passions, but in our own way, we're contributing to spreading the word of better nutrition.
Yeah, but I mean, you've been a very key part in these conferences, which I would say reach hundreds of thousands of people, if not millions. So through YouTube and other means. So don't sell yourself too short. You're certainly an influential guy.
Well, thanks, Andreas. I both our legacy is nutrition education, and so we started in the office, and yes, I lecture. I wrote a book. Now we share the conferences, and that's our legacy. And together we're advancing nutrition science, hopefully.
Yeah, I mean, I don't know how much I am advancing it, but I'm certainly always on the lookout for people who are, and ways to make that more easily accessible for people. But yeah, it's pretty cool that you're still seeing patients pretty much every day. I did stop doing that like 8 years ago, which is, it's quite a long time ago, but I think it was the right choice, though. I kind of miss it in a way, but not really, because what I get to do is more exciting, I think, and more hopefully impactful.
Yeah, so we had mentioned before we started up the podcast that I still have to answer to the medical authority, and it's been that way all along. And so in the United States, we see individuals that use the healthcare insurance, so they like that as a means to seek care, and so we work in the insurance-based system, and we work around it, and we have ways and means to discuss nutrition with patients, deprescribing and improving their health in that way. And there's all kinds of ways to do it, and there's all kinds of ways to educate, but this is what we choose. And you've been doing a great job doing what you're doing, and we wish you all the best moving into the future.
Yeah, well, likewise. I mean, I think it's an amazing thing. So many smart doctors and nurses and coaches and other people who are, helping one person at a time. It's pretty fantastic, and I just, in a little bit, in a way, I miss it. Like I said, it's been quite a few years, but this it's very satisfying to get to help, the real person that you're, get to follow their progress. That's pretty amazing.
Well, thanks, Andreas.
So, I mean, I think the cool thing is, to me, is I mean, as doctors, as you know, what we are trained to do and what we easily can end up doing is mostly just prescribing medications, lifelong medications for chronic disease, like type 2 diabetes, hypertension, or abdominal obesity, and everything related to that. And as you know, you don't really remove the cause of the problem. All you do is reduce symptoms and reduce the risk of complications, but the cause is still there. And I would argue, I guess you won't disagree too much, that the real cause of metabolic disease, like all these things, is primarily the food environment that we live in, where most of the foods are ultra processed, and they are very low in nutrition, and they're very conducive to drive overeating, passive overeating. And then we could discuss what the cause of that is. Is it sugar and carbs, or is it that plus a bunch of other things as well? I would say the second option there, but certainly sugar and processed carbs is part of the problem, no doubt. I think everybody agrees, right?
Yeah. Well, let's dive into that a little bit. And so the idea is that we live in a hostile food environment, and for
very tasty though.
Very tasty. They know how to appeal to our appetite, and it's unfortunate that the food industry is most interested in profit over our health.
Yeah, but I mean, that is totally true, and I don't think it's because they are bad people or anything. It's just, to me, they are caught in this perverse system where they have to chase profits, right? That's their job. They are beholden to their shareholders. They need to increase shareholder value. They need to maximize profit. And how do you maximize profit in a food company? Well, it's about producing cheaper foods that are less costly to produce, and that people want to buy as much and eat as much as possible from. So there you have it. The incentive is to find cheap ingredients, which are also low in nutrition, and then combine it in a way that makes people want to eat and buy as much as possible. So there you end up with foods that are low in nutrition and drive overeating, pretty much. And so that the maximum profit point, the optimal profit, is the same food that drive optimal diabetes, optimal obesity, optimal hypertension, they match. So it's not a coincidence that ultra processed foods are like the worst possible foods for metabolic health, or that, you know, even if you want to fatten rats or any other laboratory animals, the best way to do it is just to give them ultra processed human fast food or junk food. It's pretty amazing, really. And you think, wow, that's a coincidence, but it's not. It's not a coincidence. The food has been optimized for that. That's the goal, because the more people, the more food you can make foods irresistible and make it so that people want to eat more, the more you will sell. So, yeah, I mean, I just didn't quite understand this fully, I think, before, but now it's like, okay, wow, there are actually 1 million people working all the time trying to make our food system as obesogenic as possible, because that's where the profit is. And then we ask, why do we have an epidemic of obesity and diabetes? Well, that's why we have 1 million people who are working day and night to make it so.
Yes.
Like, wow, that's pretty unfortunate.
Yeah, so the food is highly palatable, highly addicting, and you know, this is just how industry works. And two thoughts: it's frustrating how often industry will attach a message of health to these foods that we don't think are necessarily so healthy. So sugar-coated cereal with a heart healthy label, and it's supported by the heart industry, the heart health, American Heart Association. And the question is, how do we get industry to align with the needs of our health?
Yeah, I think there are only two ways. Either you force them, well, it's the carrot or the stick, if you will. And the stick is government or legislation, but that's not my area of expertise, and I'm not sure that's very doable even. And, you know, depending on your political views, it may or may not be desirable. So I'm just leaving that aside because I know nothing about it. But the carrot is what I find interesting. That's about changing the demand in the equation. So if we can inform and build tools that make it simple for people to make better choices for their health, that are still, you know, affordable, convenient, and tasty, then more and more people will do so, I would argue. And then I think the food industry will only be entirely happy to change the foods that they produce if they can get to sell it at a profit, versus, you know, producing foods that people are not buying. That is not going to be a profitable thing. So you change the demand. If people buy different foods, then industry will produce different foods. So that's the sort of direction I'm taking.
Yeah,
trying to support that.
So it's a grassroots effort back to the people,
Yeah,
and
for sure.
To educate the people, for them to be well informed, and then for them to make the right food choices. And then
I think the problem is it can't be, I think, we can't expect everybody to eat grass-fed organic foods and cook everything from real ingredients. I mean, to the extent that people can do that, it's great. Don't get me wrong. I think we should encourage that 100%. But we also, I think, need much more convenient, cheap, fast options. So that's the real challenge. How do you make it simple, fast, and budget-friendly to eat good food? That's the harder problem.
Yeah, well, look, there's those that argue that government subsidizing healthier sources of food is potentially possible. So more animal protein, less grain. And so there's a lot of aspects to it. And from my perspective, I like to come at it from all angles, that yes, there should be a grassroots effort, but we should be working on the political level, talking, having conversations with those who make choices in terms of food guidelines, talking to industries, talking to producers. And, we try to bring in all those aspects at our conference and have different people share perspectives. So I think we keep plugging away. And, my perspective is within the healthcare industry to bring about change from that angle.
Yeah, sure. Of course, if the government subsidized healthier foods, that would be great. I don't hold my breath for them to subsidize more animal products and less grains, though. That's probably going to be a bit of a stretch, but who knows? Maybe.
Look, I know we're independent thinkers. We like to think outside the box, and a lot of people have thrown in the towel in terms of the authority and industry and the government listening, but we're just having the discussion, and there needs to be change.
Sure. Yeah, there needs to be change, no doubt. I mean, as you know, the obesity rates and diabetes rates and hypertension rates all keep going up. The latest study I saw from the US, I think from earlier this year, and 93% of adult Americans have poor metabolic health. 93%. And we're not talking about not being at optimal level. We're just talking about achieving normal blood glucose, normal blood pressure, and normal waist circumference. It's not a super high bar, you would think, to pass, but yet only 7% achieve it out of adults. And if you look at people who are like in their 50s or above, I think it's only 3% who achieve these numbers. So slightly older people in the US, only 3% are metabolically healthy.
So
that's
I'm going to say,
amazing.
I'm going to say you're exaggerating. That's insane.
Well, that's what the data shows, as far as I know. I mean, I agree it's insane, but it's also reality.
Wow. Well, I mean, that's our whole effort, that the approach to nutrition, whatever we've done over the past 5 or 6 decades, are not working.
No, I think it's fair to say that what we are doing is not working. And I think that the biggest flaw in our thinking has been this focus on calories. No doubt, from a physics standpoint, thermodynamical standpoint, what goes in must come out, and what you eat you have to burn. And in the short term, certainly eating less and running more will lead to weight loss. It's just that in the long term, it's very, very hard to practically do, because you have this set point. And if you just try to eat less, you will become more hungry. And if you keep eating less, then you will become really hungry and obsessed with food. And eventually, almost anybody will break and just eat to get back to their earlier levels. And even for the 1% or whatever who could do it forever, I'm not sure that's a good idea, because you're not going to feel your best ever doing that. So I think it's just a very flawed idea. And I'm not trying to contradict on the laws of physics. I'm just saying that it's not a practically useful approach for the vast majority of people, and that we need to rethink that and focus instead on the quality of food, because this has been shown in a number of studies that if you eat higher quality foods from a satiety perspective, higher protein, lower energy density, more fiber, etc., then you can eat as much or as little food as you want and still lose weight. At least this has been clearly demonstrated in very thoroughly controlled short-term studies. So I think that's pretty cool. You can actually ignore the calories, just focus on better foods, and get better outcomes long term, most likely.
Sure. Well, traditionally, the whole idea is that we want to deprive ourselves. And I think from a psychological standpoint, it's very hard to do that just eat less, deprive yourself of food, go out and exercise and become more hungry, but yet you have to deprive yourself. And so what I like to talk to our patients about is what I call mindfulness. And so it really ties into just what you said in terms of finding foods that satiate. And you talked about the nutrient density of foods, but the focus shifting away from eat less, exercise more, but to find foods that satiate. So you're not as hungry, and you just naturally will eat less. And I think that's what you were alluding to there a few moments ago.
No, I mean, I think mindfulness and intuitive eating is great, meaning that you eat as much or as little as you want, as long as you eat quality foods. Because if you do that, if you go to, maybe I shouldn't name any names, but like a fast food restaurant and you drink sugary sodas and you eat cookies and candy and donuts, etc., and you try to do that intuitively and mindfully, you're not going to get a good outcome. Eating intuitively only works when we eat foods that our bodies are adapted to eating, like real foods in certain ways, right? And ultra-processed foods, if you eat that mindfully, you're going to overeat. Everybody does. So it's like if you have kids, send them into a candy store and say, well, eat mindfully and intuitively. I mean, it's not going to end well, right? If you do that every day.
That's a great analogy. It's not going to work.
No, it's not going to work. And we are the same. We're not that different, even if we're a bit older. We also get, our bodies also get tricked by this kind of food.
So let's talk a little bit more about these nutrient-dense foods.
Or tell someone who is an alcoholic, addicted to alcohol, and tell them to drink mindfully and intuitively. Not a great idea.
Another great analogy, Andreas, and I totally agree. So yeah, let's talk a little bit about what are nutrient-dense foods and what that means and how that might be different than the original message from Diet Doctor.
Yeah, sure, absolutely. So, I mean, originally we've been very much, and I've been very much focused on lower carbohydrate diets, keto diets, low carb diets. And I mean, I'm still a big fan of that. I still eat low carb. I've been eating a low carb diet for like, depending on how you count, maybe 16 years, including low glycemic index diets, probably 20 years. So, and I still do. So I'm a big fan. However, I'm less of a believer in that lowering carbohydrates is the main thing, the big and dominant thing that you need to focus on to achieve good results. I think there are numerous factors, and when you talk about nutrient density, I'm thinking of it as sort of protein percentage of food. You can think of food as being made up of two main things. Like humans eat for two different reasons. We need nutrients to build our bodies, and then we need energy to run our bodies. It's like a car. You need the materials to build a car, and then you need fuel to run it. And we are a little bit like that. Now the nutrients that we need to build our bodies, that's basically protein with a little bit of minerals and vitamins and so on. But that usually comes packaged together with protein. So it's usually the same foods, contains all of it. And then you have energy that we are mainly getting from carbohydrates and fat. And the really interesting thing is that there are a number of studies showing that humans tend to eat enough food to get the nutrients, the protein that we need. And if you dilute the protein in the food supply, if you eat foods that are mostly energy and very little protein, then you have to eat much more to be satisfied. But if you eat higher protein foods, then when you get the protein you need, you haven't eaten as much energy and you tend to eat less. So there's this thing called the protein leverage hypothesis, that there are some really interesting studies demonstrating both in humans and in animals. And basically what the modern food environment has done is it has diluted the protein. So our ancestors, they may have eaten 20% protein, maybe even 30% protein. But today in the Western world, we might just get 14 or 12% protein in ultra-processed foods on average. And that means, well, we have to eat probably twice as much energy to get the same protein. And that could explain a big part of the problem we're in today. And that is perhaps the reason why a lot of studies have proven that if you increase the percentage of protein in food, then people tend to eat less. And higher protein diets tend to be effective for weight loss and maintaining a good body composition. So I think that low-carb diets, what they tend to actually do is that they raise the protein percentage. And this has been shown in pretty much all of the studies that demonstrate that low-carb works really well for weight loss and metabolic health. In all of them, people also eat more protein. So the difference can be pretty big from maybe 10% more protein, 5% more protein, which makes a huge difference actually to food intake. So there are probably different, multiple reasons why low carb works, but the protein thing may be one big factor. But it's interesting because you can also lower fat intake to increase protein percentage. So low carb and low fat, they both can work, and perhaps for pretty much the same reason. That's interesting.
Excellent, Andreas. So it brings us back. Basically, protein leveraging is the significant factor. And I know that Marty Kendall and Ted Naiman have really been focused on the protein factor for years. And they've been influences to all of us in terms of they're emphasizing the importance of protein. And, I have to back up and just ask, you explained that low carb works because of the protein leveraging, but
partially. I think there are multiple reasons why low carb works, but I think that the protein leverage thing can be one big factor. It's also one clear factor is that if you avoid carbohydrates, you're also pretty much going to avoid all the ultra processed foods because it's all got plenty of carbohydrates, and then you avoid all the problems that they have beyond the protein side, which is, for one thing, they can be ultra rewarding, very hard to stop eating. They're low in fiber, they're highly energy dense. There are other problems with them too. If you go on a strict low carb diet, you pretty much avoid all those bad foods. And some people on low carb diets, they also avoid seed oils, right? So there you go. And avoid a bunch of added fats as well. And maybe you're focused on real foods and cooking your food in your kitchen. There are all kinds of reasons why that is going to be probably a great idea. So I guess I don't think we need to have the insulin explanation necessarily, because I think that has, unfortunately, I used to be the biggest believer you could find when it comes to the carbohydrate insulin model. But today I actually think it's, if it's a factor, it's not the biggest one, I don't think.
Okay. Yeah, well, that's where I was going to head with this. And we know over the years that if we have type 2 diabetics or patients that do have a problem with insulin, the high fat diets, and we're talking up to 70% of calories from fat, initially really help. And so my question is, does the diet change with time? So based on your metabolic health and your body composition, is it fair to say that patients can start out with a higher fat diet, and also considering that calories or that fat is caloric dense, I think that has to come into the equation. But as time goes on, the diet can perhaps change.
Yeah, I mean, like I said, I'm a big fan of low carb and high fat diets. I think they are definitely an option, and that certainly they can be effective for lowering blood glucose, no doubt about it. I'm not sure you have to take that way, though. It's a little bit tricky if someone with type 2 diabetes and lots of medications go on a strict keto diet. They may almost need doctor supervision to make sure that they're not overdosing on their medication, because they are going to need a lot less if they are on insulin, for example, a lot less. And staying on the same dose could even be harmful, right?
Right.
And I mean, I think that there are plenty of studies showing a good effect of a higher protein diet with type 2 diabetes or pre-diabetes. There's one interesting study from last year. Granted, it's not huge. It's, relatively small. But what they showed was that when they fed a group of people with pre-diabetes a 30% protein diet, as compared to a lower protein diet, then in the high protein group, 100% reversed their pre-diabetes and went back to normal blood glucose levels. So I think it was like 20 people or so. 100% of them got normal glucose, and this on a not super low carb but high protein diet. I mean, just to me, it shows that at least some interesting indications that you can get good results on a high protein diet, whether it's low in carbs or not.
Well, I just don't want our audience to think that Diet Doctor has given up on low carb and keto.
No, but I'm trying to be clear that I'm still very much in favor, and these are great options for a lot of people. They are proven. Also, good studies proving the effect. All I'm saying is, I believe there are other options too.
And you had mentioned to me previously that the reason that low carb or keto is working because of perhaps protein leveraging.
Yeah, I think that's a bigger factor than the regular insulin explanation, most likely.
And the food quality. I mean, there's a lot of factors to consider.
And yeah. I mean, low carb is clearly an approach that works. On average, it improves the diet quality for the vast majority of people, and delivers good results for a lot of people. However, a keto diet, I believe, is hard to sustain long term for many people. Some people do great, do it for years and years and years. For other people, it may become a little bit restrictive. And then I think it's amazing to have other options, right?
So, yeah, that's an amazing statement from Diet Doctor, what you just said.
Yeah, you think, are you surprised with me updating my point of view?
Right, that you said that keto or high fat diet is hard to maintain long term, but that's what you said.
I think for many people it is. I mean, I frankly, even for myself, staying under 20 grams of carbs is challenging long term. What do you think?
Well, it's interesting. We have Lane Norton who's coming to speak, and so he likes to say to find an approach that works for the individual, and so it's different for everybody, and I like that. And so,
I mean, if someone's happy eating 20 grams of carbs every day and getting good results, all credit to that person. That's great. I just think that for a lot of people it's hard, even for me.
Yeah, well, look, it's complicated, and for me, long term, I do focus on protein leveraging, and that.
So can I ask how many grams of carbs do you eat in a day? Do you think?
Protein for myself?
No, carbohydrates. How many grams of carbohydrate do you eat in a day on average? If you were to guess.
Right. Well, it's different for everybody. And so generally I say under 40 grams is keto, under 80 grams is low carb, and under 120 grams to me is kind of the upper limit. And so for myself,
I'm probably under your upper limit.
On the upper limit of carbs.
No, at least I'm gonna stay under your upper limit, I would say.
Yeah. So there's a lot we agree upon. So I figured
Yeah.
you would like those numbers. And so for myself, I probably stay around 40 to 80 grams of carb. I had problems
Yeah.
with weight a long time ago, and
Yeah.
I had kept off 40 to 50 pounds. But I focus on protein personally.
Yeah, exactly. No, I think 40 to 80 grams is way, my point of view, way easier to do than under 20 for sure. Much, much easier.
Yeah, and I explain that to people. If they're happy doing that and they want to be carnivores, that's fine. But for our patients long term, again, we focus more on increasing protein. And I love Ben Bickman has alliteration where he says to fill with fat, meaning that you eat enough fat to fill. You prioritize protein, and you control your carbohydrate. And that's somewhat our mantra that we've stuck with over the years with the patients. And I have to bring in another factor and ask, and I briefly mentioned before that, fat is caloric dense. And at the end of the day, I think the idea is to control people's appetite so they're not as hungry and they eat less. And yes, that means that they're reducing the amount of calories that they consume in the day. And so what are your thoughts about that?
Yeah, I totally agree. I think that the biggest problem with low carb, high fat diets is the high fat part. And I think that some people would be happier and would feel more successful if they didn't overdo that. So, for example, bulletproof coffee or, pouring lots of fat on all the food, lots of fat on all the vegetables. I think if you reduce that a bit, you will probably do better. One interesting thing is, over all the years I've been reading and listening to people, so many low carb experts saying that if you're not reaching your goals on a low carb diet, try to eat less dairy and eat less nuts. And there was never any really great explanation to me why that was the case. But just so happens that butter and heavy cream, which are staples in low carb diets, and dairy, they are also extremely high or low protein, low nutrition, right? And same for nuts, like macadamia nuts, for example, almost no carbs, but it's also almost no protein. It's just fat, right? And I don't think we have to make up some special explanation. It's just those foods are not great for weight loss, period. And just because a low carb approach can't explain that, it doesn't make it less true, I think.
Yeah. And also just to clarify that, fat is void of nutrients and micronutrients. It's just calories.
Exactly. So in a way, it's empty calories, whether it's processed carbohydrates or processed fats. Added sugar or added fats. It's not the same, but it has similarities. It's added calories without nutrition, without much satiety per calorie.
That's great, Andreas. Well, we're looking forward to hear more from you about this at the conference. And as I alluded to or mentioned before we started to talk here, the recording, that I wanted to invite you to participate in the panel discussion on Friday morning. And that should be a really interesting one. We have Lane Norton, Thomas DeLauer, Brett Scher, and Bill Schindler, all addressing the theme of the conference, where is nutrition headed? And we're all going to share some different perspectives. And I think you were the one that inspired us to come up with a theme for next year, and rightly so, that you should be part of this panel discussion.
Well, I'm honored, and that sounds like a great panel, and I'm going to have a lot of fun, I think, participating there. I think those are some excellent people that I will enjoy chatting with. And thanks for inviting me. And I think that the theme of the conference that you chose is great, because I think that there's more to this than low carb, pretty much. And even though low carb is great, obviously. So I'm looking forward to the conference and seeing where nutrition is heading.
Well, great. So we'd even toyed with the idea of rebranding the name of our conference. And
so what would it be then?
we're still working on it. Maybe you can give us some suggestions.
The future of nutrition.
There you go. Well, I know things are changing at Diet Doctor, and you're certainly giving it a thought in terms of where is Diet Doctor headed?
Yeah, huge changes coming up, no doubt, in all kinds of ways. Much more to say about that, but I mean, we've been working on this for a year and a half, transitioning in a way to what we think is the future of nutrition and metabolic health, and just living your best life, having the energy and strength to do what's important for you in life, and that's what we're building towards, to finding sustainable, effective, and enjoyable solutions for that. So lots more to say, but this is not the time. Unfortunately, I don't have any more. I can't give out the details today yet, but it's coming soon.
Well, great, Andreas. As we get closer to the conference, and at the conference, hopefully you'll have more to say.
Yes, I'm sure I will have more to say.
Well, great, Andreas. Well, just to finish up, I always like to ask, what do you enjoy most about coming to these events in person?
Well, for me, it's the best place to come and meet interesting people who are equally interested as me in this, health, food, and science, and everything around that. It's a great place to network and learn new things and talk to exciting people in this area. So thank you for setting it up. I mean, I met a lot of great people who I'm friends with today, thanks to those conferences. So I'll keep coming as long as you have me.
Well, you're welcome, and it's my pleasure to have it and to have you, Andreas. The only problem is we're both introverts, and so getting out into the public is sometimes a challenge.
Yes, I'm very much introverted, but I don't know what to say. I still enjoy talking to people who are knowledgeable and passionate about these things that I'm also passionate about. So I mean, being an introvert doesn't mean you don't like hanging out with people, right?
Well, these events, it brings
Sometimes,
you out,
at least for a while.
it brings you out from under your rock.
Maybe not 16 hours straight.
Yeah. Well, great. And how can people find out more about you?
Well, they can go to dietdoctor.com, or they can follow me on Twitter. I guess those are the main places.
Great. And to our audience, if you want to hear more from Diet Doctor, meet him in person, as well as our other speakers, please consider joining us in February. And to find out more about the conference, please visit lowcarbconferences.com. So that's all for now. Thanks, Andreas, and we'll catch everyone next time.
Thank you, Jeff.